October is Breast Cancer Awareness Month. It is an annual campaign to increase awareness of the disease. What is breast cancer screening? Breast cancer screening is a way in which doctors check breasts for early signs of cancer in women who have no symptoms of breast cancer. The goal of breast cancer screening is to find cancer early before it has chance to grow, spread, or cause problems. The main test used to screen for breast cancer is a special kind of X-ray called a mammogram. Studies show that being screened for breast cancer lowers the chance that a woman will die of the disease. Starting at the age of 40, it's important to talk to your doctor or nurse about the benefits and drawbacks of screening and decide with your doctor or nurse's help whether to get screening and when. Some women who are at high risk of breast cancer might need to begin screening before age 40. Talk to your doctor or nurse to see if you should start screening earlier. For example, you might need to do this if you're under 40 but have a relative who got breast cancer at a young age, or if you have certain genes that increase your risk of breast cancer, such as BRCA. What happens during a mammogram? Before the mammogram, you will be asked to undress from the waist up and put on a hospital gown, and you will be taken to the X-ray room by the nurse or technician. Then your breasts will be X-rayed one at a time. To make the breast issue easier to see, nurse or technician will flatten each breast between two panels. Each breast is typically X-rayed twice, one from the top down and once from side to side. This is so the radiologist can get a good look at all the tissue. Getting a mammogram can be uncomfortable, but it lasts only a few seconds. If possible, avoid scheduling your mammogram just before or during your period. Breasts are extra sensitive at that time. Also, do not use underarm deodorant or powder on the day of your appointment. What happens after a mammogram? After a mammogram, if a radiologist, the doctor who will look at your X-ray, is able to look at your mammogram right away, you might get results the same day. If not, you should get a phone call or letter with your results soon. If it is normal, how often should I have a mammogram? Many experts suggest mammograms every 2 years for most women, while others suggest mammograms every year. Some experts base their recommendation on the women's age. The schedule for screening might also be different for women who have a high risk of breast cancer. You can talk with your doctor about how often you should have a mammogram based on your risk as well as the preferences. What if my mammogram is abnormal? If your mammogram is abnormal, try not to panic. 9 out of 10 women with an abnormal mammogram turn out not to have breast cancer. If the doctor thinks you're abnormal, but result is probably not due to cancer, he or she might suggest that you have another mammogram in 6 months. In other cases, the doctor will send you for more tests such as ultrasounds. Can I have a breast MRI instead of a mammogram? You might have heard about breast MRIs, but they are not for everyone. They are used along with mammograms for screening high-risk women who need them. What are the drawbacks to be screened for breast cancer? Mammography can have drawbacks as well. Number 1. False positives. Mammograms sometimes give false positive results. This means they suggest a woman might have cancer when she does not. This can lead to unneeded worry and to more tests, including a biopsy in some cases. Number 2. Radiation exposure. Like all X-rays, mammograms expose you to some radiation, but studies show that number of lives saved by finding cancer early greatly outweighs the very small risks that come from the radiation exposure. So remind your mother, sister, or daughter to schedule an annual mammogram.